Hello, everyone, and welcome back to another episode of The Coded Switch. I am your co-host, Dr. G in the United States, joined by Toltu, the Psychologist in Melbourne, Australia. So on today's episode, we're going to get into a continued conversation of imposter syndrome, but this time talking more about the proactive side of things of what to do. What do you do in situations when your imposter syndrome or those thoughts of being an imposter start to get really strong in your mind, and how do you counteract them? So stay with us. We'll dive into all of these topics and more on The Coded Switch.
Welcome to the Coded Switch podcast, a deep discussion about the experience of intersectionality and vulnerability as it relates to wellness, hosted by Dr. Galanega Machisa and Toltu the Psychologist.
All right, welcome to everybody who's just joined in. If you've been following us on the recent episodes, we have been looking at the idea of code switching through the lens of the imposter syndrome. So, imposter syndrome, that feeling of inadequacy, that feeling of self-doubt that people have. And this is regardless of your ambition, regardless of what you've done in your life and your achievements. It's that feeling that you're just not good enough. And often that translates into, behaviors that are not always serving your needs. So what does that look like in your life when you're experiencing imposter syndrome? Like, I'm sure you can list heaps of them, Dr. G. What is it? Like, just don't go for jobs.
The one thing that jumps out in my mind, because I experience, it's just the ruminating, right? Like the going over things like several times before they actually, like thoughts before they actually become words and exit your mouth, or, thinking of all the different ways that something might be interpreted, or just spending a lot of time in your own head about how you're being perceived, how you want to come off, a lot of editorializing going on in your mind. So that's what it feels like, at least in my experience. I'm sure there's a lot more to it that other people could speak to. But yeah, so I think what I would like to know, and I'm sure I'm not the only one, and you can help us all out here, is what do you do? Like in a scenario where, let's say I'm interfacing with, let's bring it just for, to make it a little fun. Let's talk about when there is a power dynamic between someone you're engaging with and in yourself, and you're starting to do this, in really becoming insular and internalized, and having this conversation almost simultaneously as you're having an outward conversation. What do you do in those moments to maintain clarity and maintain, poignancy, so that you can express yourself and be heard the way you intend on being heard? What do you do?
The moment that you're experiencing imposter syndrome, you can go about it in a practical way. Like, I can tell you right now, these are the things that you can do. If you're experiencing imposter syndrome, here's what you can do, A, B, C, D, in a practical way that others can see. There is also the side to imposter syndrome where the work needs to be internal. Here are the things you need to say to yourself and do within yourself. And I think the quickest one for when you're experiencing that imposter syndrome in terms of how to project outwards is to really remind yourself why you were invited to be in that position in the first place. Right. Remember that there's a reason why you were called there. There's a reason why you made it through the interview and someone else didn't. There's a reason why your partner chose you to be their lifelong partner as opposed to someone else. And you need to go back and think about what those specific things are. I am here because I applied for this job. I'm here because I worked for it. I'm here because I have experience. I'm here because compared to the other people, I know more about project management. So think about, why are you there? And then do what you were invited to do. That's the quickest way to sort of, in the moment, be like, oh my God, what am I invited to do here? Yeah. Do it. That's literally what you're meant to be doing. And if you're, worried about whether you're the right person or not, it's about thinking about why you were invited over somebody else.
What if that isn't apparently clear? What if that isn't that, of course you can, because I think, depending on the degree of imposter syndrome that somebody may have, be experiencing, or how long it's been living with them as almost like an entity, it can go a lot deeper than that, where you can start to, because second guessing is a big part of it, right? Second guessing oneself, you can start to second guess those reasons that you're giving yourself. So, I'm just trying to, say, like, okay, I totally hear what you're saying. It is brilliant. And I think it does help in the moment, especially when you are or just before engaging in maybe with in
Uncomfortable discussion.
an uncomfortable discussion, or in a dynamic that there is a power differential. It helps to do this, certainly, but more so like, well, what happens when the troubleshooting turns into more trouble, right? And you start to second
Yeah.
get, like, what is there anything that can get at the second guessing?
I think this is where we need to do the internal work, because the second guessing is usually your own self. And so often what will happen is that we start to fall into these thought traps. There's so many, and the fancy word for it is cognitive distortions. When you're experiencing imposter syndrome, you're more often than not falling into the traps that your mind is tricking you into. So some people, it's about blaming. Like, people jump straight into blaming yourself or others for things that go wrong. Oh, well, it's not because of me, it's because of you. There are others who, and I could list these on. There's personalization, should statements, labeling, catastrophizing, mind reading, discounting the positive, focusing on the negative, false consensus, denial. These are all the traps that we fall into. And I think sometimes knowing that you're doing this is really important. So people don't even recognize they're doing that. So it's about slowing down the process. When you're experiencing imposter syndrome, you're going from 0 to 100 very quickly and creating uncertainty for yourself. We need to slow that process down and be like, what are you doing that's contributing to this situation? Because what you perceive or the way you see a situation is going to be what you believe. And what you believe is going to be what you achieve. What you do is going to be dependent on how you see on how you see it. And people say, well, that's really easy to say. Well, how do you get out of that? Or like, how true can that be? It's the reason why you look at a piece of food and be like, oh my God, I can't keep my hands off it. And the same piece of food, if your mindset changes, doesn't even want to have anything to do with it. Yes, your environment may be toxic. Yes, the person might be doing, the person may be doing these, engaging in a dynamic or behaviors that's incredibly soul destroying, but how you respond to it is what matters. And you start with yourself. Are you going to accept this?
I think you went. I mean, there are really, really good points in there. I wish we had the time to dissect each and every one. But one thing that you just said, I think, is critical here, and that is the slowing down. Like, one has to slow down in that process. Do you have any sort of guidance on how does one slow down in the moment? Are there any practices or exercises that somebody can do to help slow that snowball tends to start barreling down the hill?
So a good way to slow down is before you begin to slow down, I think the awareness and the education is really important. Recognizing this is what's happening to you. So if you've tuned into this and you're like, oh, is that what I'm doing? Okay, how do I slow this down? I think starting physically is really important. So recognizing that when you're starting to feel anxious, it shows up in your body. Yes. So you might be starting to tap, you might starting to breathe shallow, you feel your, skin flushing. It's not menopause, it's not someone you like, it's actually someone's genuinely frustrating you. So you might have, or, for others, you might find yourself starting to get numb. So people get numb, they start to freeze. They're like, it's just time to go through the motions. Let's wipe this off. This is what people start to do. So to slow down that process, one of the things that I think is really important is actually pausing.
Yeah.
People feel like they need to respond in the moment all the time. Never. And imposter syndrome usually relates quite closely to conflict. So when you're in a conflict situation, you'd use the similar strategies as you would for imposter syndrome as you would managing conflict.
Can you explain that? That's fascinating.
Yeah. So when we're talking about managing conflict, we need to slow down the process in terms of your responses. So literally from deep breathing, pausing, feeling like you don't have to respond immediately. Silence is really important. So if someone says something to you, there is nothing wrong with just sitting silently, even if they're asking for a response. It can even be as simple as, I'll need to think about that. I'll get back to you. Thank you for letting me know. Because people have this this belief almost that when you're in a conflict dynamic, that you need to respond. Like it's a match, like a tennis of back and forth. You don't need to do that. Someone can say something to you, you can just let it land. and just leave it there. And by doing that, you bring power back to you.
Yeah.
You bring
I'm
certainty
so
back.
glad you said
Now,
that
if
word,
you,
because that's what was power. That's exactly what we're
yeah,
circling around here. So I didn't mean to cut you off, but
go for it.
no, this is, I mean, I think that's brilliant. I think we often don't do that in just like regular conversation, even, let alone conflict, is just take the time to be present in what we're saying, and feeling like we sort of need to continue on with the next statement. And, often it can lead us somewhere that we don't intend to be. And the same, I think, would be very true in those instances where you feel like there's almost a compulsion to speak and to respond. And of
Yeah.
course, usually, I mean, we're also kind of skirting around this here a little bit. I think we brought it up last time, just a tad, was about how imposter syndrome is also very closely tied to power dynamics, right? It's there,
100%.
I mean, even, I mean, every conflict really, outside of, and this may not be true across the board, but outside of peer relationships, like actual friendship type of
Yeah.
relationships, and maybe, well, no, not parent child, because obviously there's a power dynamic there too. Every other type of relationship does have a power dynamic, and
Oh,
yeah.
100%. And when you're in an imposter syndrome, again, there's that conflict, right? And people like to think of imposter syndrome as the problem is with me. And the problem is actually that you're not reclaiming your
Yeah.
power. And so people think, but I'm not powerful. But what is my power? Well, you have the power to
Right.
respond. You have the power to stay silent. You have the power just to take the situation in. And this is what I'm talking about, reframing the situation. Often when someone is in a position of power, they're expecting a response. You don't have to give one. You can ask for a timeout. You can say, well, I'm going to have to get back to you on that. It could be in the moment where someone's trying to put you on the spot. You may choose in that moment not to respond at
Yeah.
all, and then go to them at the end of the day and say, hey, I'm wondering if I can talk to you about a situation that happened earlier. Would you be okay for me to bring it up? People are curious. Even those in power are always curious. So, and you'll say, I wanted to reflect that in that moment. I wanted the opportunity to say these things, but I didn't get that chance. That's if you want to do that. You don't have to do. There's so many different ways of doing
Yeah.
it. I think the most important thing is slowing down the process, recognizing that you do have power. It's a question of what are you doing that's being an obstacle? Are you personalizing this? Are you labeling yourself as a loser? Are you mind reading and being like, oh, they said this, so this and this, and therefore this? Like, what is it that you need to recognize those feelings within
Yeah.
yourself? And I think that is step number one. Recognize when you're experiencing imposter
Yeah.
syndrome. You need to reframe your thoughts through your mindset and think, well, hang on, is there another way that I can look at this situation? And you can only do that when you slow down the process. And people are like, oh, I just want a pill that says getting rid of imposter syndrome, swallow it and off I
Yeah.
go. But it doesn't work that way. It's about really, and often talking to someone about it is really
Yeah.
important because they can provide like a bit of fact checking for you.
Oh, yeah.
Like, yeah, actually you're
Yeah.
right. Or no, look, maybe you are taking it a bit personally. And so sometimes, you may do that with friends. You may do that with someone professional, depending on what the stakes are. So a lot of times when I'm coaching usually executives who've started in their executive position and trying to strategically pitch themselves as leaders, especially among situations where people are challenging your leadership, it's about coming up with those scripts that reflect your
Yeah.
mindset. So it might even be, so you might need to do the education. You might need to do the research. The power of negotiating. Negotiating is about managing the
That's
power
right.
dynamic.
Yeah.
Conflict is when power falls out. Imposter syndrome is when you feel like you've lost your power. So this is about reclaiming your power and finding a place where you can do that authentically.
Absolutely.
So you don't want to be power tripping
That's
over
right.
people.
That's right.
You
Yeah.
really don't.
That's right. Yeah. Absolutely. So I want to take this back one more step. So we talked about sort of what you do in the moment when things start to maybe get out of hand, out of control in your thought and in your mind while you're in the situation. But let's go one step more upstream and just, I'd like to know sort of if you have any thoughts on how do you even bring awareness. For example, if someone is essentially like, if an observer could watch a person's life, they'd be like, this looks lot like you have imposter syndrome, but the individual is not aware. of the things that they're doing that are sort of exhibiting that trait or those traits. How does one start to dial in, become more aware of the things that they're doing that are aligned with an imposter syndrome? I don't know if that makes sense, but
Yeah, it does. I think a lot of people recognize when they're experiencing it. It's like code switching. You may not have the words for it, but you recognize you're
yeah,
doing it. People that imposter syndrome is really that
yeah,
self-doubt when it takes over your life and takes away opportunities from you that you think that you
yeah.
deserve.
Or
So,
maybe not.
the
Maybe
difference.
not. Okay, so let me frame it another way. So the behaviors that you were describing that are often found, or connected with imposter syndrome, like one of the ones that stuck out to me is catastrophizing, right? For example, like
Yeah.
how does a person become aware that what they're doing in their thought is that it is a cognitive distortion? It actually is, like, there's something that is not aligned with the reality, as the objective reality, let's say, of course, because subjective reality is real for the person.
Yeah.
How does one become more aware of those traits? I mean, is that only through the help of a professional, or is there something that,
No. No. So there are definitely the way you know it is from behaviors. What does imposter syndrome look like behaviorally? Particularly, I'm going to talk to the workplace because I think that's often where people talk about imposter
absolutely,
syndrome. So, yeah, so in the workplace, it can be difficult to decipher in one moment, but you can see the patterns over time because sometimes, let me give you one
yeah,
example of how imposter syndrome can be misinterpreted. When you see somebody smiling can be a sign of happiness, reflecting the emotion of happiness. It can also be reflecting the emotion of anxiety, right? So smiling in and of itself is not necessarily a good or a bad thing, but if we can see where it's coming from, that's what might determine whether the smiling is helpful or not. The same thing with the behaviors around imposter syndrome. So usually someone who's experiencing imposter syndrome will start comparing themselves to others. So they'll say, especially those who they believe are more talented or more better, they'll compare a lot. There will be a lot of self-doubt within themselves. They'll say they don't deserve their achievements, or they're not worthy, someone else should have gotten the award. Another big one is perfectionism. People who are constantly feel like they need to be perfect in order to be successful. They are overly concerned about making mistakes, and then they start to overanalyze and overthink things. Overworking is another one. So they feel like, I need to work harder than everyone else. I need to be the first one in and the last one out to prove themselves that they're worthy. And in fact, what they end up doing for the most part is just burning out. The other big one is being fear, like that. There's this fear they have that they're going to be found out. Someone's going to realize that they're not actually as competent as they are. And so that leads to feelings, for the most part, of anxiety and shame. So, shame being that fear of disconnect. And I think that's what the imposter, person who has those imposter syndrome feelings are. They want to feel connection. And so, the idea of shame being that if somebody discovers this, they're going to be removed from the group. They're going to be an outsider. They're not going to be welcome. So that fear really exacerbates that anxiety. So therefore they start working really hard and they don't want to make any mistakes, and they compare themselves to others. And even when they get recognized, like, no, it's just not me. These are classic signs of imposter syndrome present in someone. And what can you do when you see someone like that? It depends on where you are in that dynamic. You can be a colleague, you can be a boss, and you can just acknowledge that, but hey, I just want to let you know I see what you're doing. I think I think you are fine just as you are, and you don't need to work as hard as you are. Like, I see you. It's about being seen and about being heard. And I think when you're being seen and heard for what you are in your authentic state, then you're less likely to overwork. You're less likely to be, a perfectionist of sort. I think there's space for balance. So people say, I know I have imposter syndrome. I'm exhibiting all of these traits. What do I actually do about it? And that's where I think the strategies I spoke about earlier, slowing down that process, recognizing what cognitive distortions or what thought traps are the ones that are holding you back from stepping into your own in an authentic way. So I think, in short, those are the ways that I'd be looking at overcoming imposter syndrome. And you can listen to this podcast and be like, that's fantastic. But this is not a substitute for
Yeah.
therapy, right? So what would happen in a therapy space is I've just told you all this generic stuff. In my mind, this is all generic. You might be like, oh my God, she's really speaking to me. To me, this is very generic. Where it becomes personalized would be in a therapy space. I would sit with you and say, okay, talk to me about the problems that you're having. And you tell me the problem, and all of that generic stuff, I would reformulate it back to you. This is why it's happening to you on this occasion at this time. This is the pattern that you're exhibiting. This is why it's showing up for you. So for you, this is the strategy that you need. For your situation, this is the first thing you need to do, the second thing you need to do, the third thing you need to do. See how you go with that and come back, and then we reflect. And I think, you know, in listening to this podcast, I think some people think, well, she's told us all the answers. What's the point of going to a therapist, right? It's like, I know I need to eat good food and exercise at least 3 times a week. Doesn't necessarily mean it's going to happen, but a PT will look at my life and say, well, actually for you, this is what you need to focus on first. This is what you need to worry about. And I think it's similar in terms of, you know, imposter syndrome being one of the top coaching requests that I get, particularly from medical doctors who move into leadership roles, where they're no longer praised for their clinical acumen. I mean, they're good at it, but now there's a whole new dimension of managing people, managing dynamics, managing budgets and things like that.
Complicated.
That often they're like, I didn't get trained for this at medical school. Like, and then, you know, when you have power over those things, people's expectations of you change too. So how do you manage
Absolutely. I think what you were getting at in the explanation of why taking it one step further and you know, doing the therapy, the work behind it is important is context, right? Context is everything. You can talk generalities from, you know, Sunday to Monday, or well, I should say Monday to Sunday, right? That's the accurate way to say it. But if it doesn't fit the specific context, I say this all the time to my patients, right? As far as if it doesn't, whatever, even if you know, we're getting these answers and we're coming up with a therapeutic plan, if it doesn't fit the context of a person's life, of one's life, it's almost useless because, you know, it's an individual that has to live it out. It's an individual that has to, like, you might know these generalities is like, oh, that's what's going on. This is what you should do in that situation. But if you can't figure out, if you can't navigate how to make it apply to the specific situation that or circumstance that you're experiencing, it's great knowledge, but it's not very helpful. It's not helpful for, right? So,
so I remember wanting, sorry, I cut you off. I remember dealing with one executive in particular who said, I can't tell people what to do. I'm always like going around and being like, you know, beating around the bush. And we agreed it was time for that to stop, that they needed to step into their own being a new manager, of being an assertive person. And how do you articulate that? So for this person, it was as simple as teaching them that when they send their emails, how to structure their sentences, so that they're not asking and requesting, and they're not asking, they are requesting. So for example, I'll say, well, I don't know how to deal with this person because they keep holding me up and saying, well, you said this and you said that. I'm like, simple. Every sentence begins with, on this occasion. On this occasion, I require you to do blah, blah, blah. On this occasion, I do not require you to attend this meeting to do this. And so when the situation changes, so too does the occasion. You're allowed to change your mind. And so people have this thing that we've said this, we need to stick with it. And so no, things can change over time. You know, it might mean something as simple as going back to contracts. If you're managing people, you know, often there's clauses in people's contracts that say, this is what you're expected to do, plus other things that you are required. So if your manager says to you, I do not require you to do this, well, then you're not required to do that if you're the particular manager. And so, you know, the fact that you have the power and the authority to do that, to use it in ways that work for you. Not saying, I want you to do this. And I'm like, well, I don't care what you want. I'm here to do my job. And so, whereas requiring someone to do something is a bit different. So sometimes it's tweaks as small as that. Sometimes it's working on the internal self. What's this ditch that you keep falling into that you can't get yourself out of? Let's keep a diary and recognize, how many situations did that happen? Are we catastrophizing here? Come back next week and we're going to go through that. And like, it happened 10 times or it just happened once, but I made a big deal out of it. So again, it's sort of trying to provide value for people in something that can be quite a debilitating
Absolutely.
experience.
And speaking of, context, I think what we should do next on our next episode is go
Yeah.
into
Okay.
specifically, right, how
Hmm.
maybe somebody who's attracted to this podcast and listening, what they may be experiencing in the way of their intersectionality, and how that maybe adds an added layer of complexity and how they're thinking about, because it does. Let's be honest. If there are, we're talking about power dynamics with everything else maybe being equal, but if we need to go, we need to become more nuanced about like
Yeah.
the complexity of the
Yeah.
power dynamics and what can be happening,
Mm.
and how somebody who's, let's say, a person of color might be sort of feeling and thinking they're being perceived with someone who's not of color, in that power dynamic. And we should speak to those sort of occasions specifically, or maybe across gender lines, or just the specifics of the context, really, of certain situations. Um,
Can I hand it to you? That was such a smooth segue. What is code switching if not for the power dynamics? And
yeah.
when you luck out of that, the imposter syndrome definitely
Yeah.
kicks in. Oh, I can't
Me
wait for the
neither.
next
And I
episode
think what we'll
already.
do as well, maybe not in the next episode because there's already a lot there to dissect, but I really would like to also bring this back to, health and wellness, and what that experience of living in those spaces can do to a person, physiologically, and the impacts that, living that
Yep.
lifestyle or living that life out, or that reality out, can start, how that can start to manifest in a person physically. Because let's face it, oftentimes, if an individual may not be aware of the behavioral side of things that are contributing to what their reality looks like, but they start to feel, like you said, the physical symptoms, maybe the first, like the canary in the coal mine, that something is not right in their lives, right? Like they're having
Yep.
headaches, they're
Yep.
feeling fatigued, they're feeling right, you're
Yep.
having abnormal bowel movements, or something that can easily, when you ask
That
enough
we don't talk
questions,
about.
right? When you ask enough questions and understand a person's life and get the context of their life, you can easily see how these things are
I think so.
well connected. So we'll get into all those things, and of course more, as we always do, on the next episode of The Coded Switch. I am your co-host, Dr. G in the US, and signing off is...
Toltu, the psychologist from Australia. We'll see you on our next episode.
Bye, y'all.